to Bermuda. Interestingly enough, you bring a wealth of experience when it comes to sports medicine and recovery. So that's what I want to talk to you about today.
Sure.
A bit about sports recovery and what services you offer here at North Shore Medical that an athlete can actually assist with if suffering from whatever injury they might be involved with. But give us a bit of your background first.
So I'm a GP by trade. I trained medicine in Australia, and then I moved to the UK. I did my general practice training, quite a bit of surgery as well. And then once I was a general practitioner, I joined the British Forces as a civilian doctor, and then I specialised in sports medicine. So I did my sports medical training at the University of Bath, which is quite prestigious. And then I worked for 8 years in a regional rehabilitation unit, which is a military inpatient rehabilitation unit, where we were rehabilitating soldiers from battlefield trauma, from military training injuries, and also from professional sports injuries.
Now, you come to Bermuda where we have professionals, but we also have plenty of amateur athletes. And I'm of the belief that some of the amateur athletes do more harm to their body because they don't have that professional advice or recovery people around them to get them back to where they need to be on a weekly basis. So what type of ideas, what type of services do you offer that can actually assist athletes with those niggling injuries that could possibly turn out to be a life-changing injury over the course of a year because they don't realize how much damage they're actually doing to themselves?
Yeah, absolutely. I think the most important thing in sports medicine is getting the diagnosis right at the start. So you've got to do that, and that takes a really thorough assessment. And so that's the bit that we very much emphasised on in my past training, and we'd often do that as a multidisciplinary team. So there might be a group of 3 or 4 of us, all with slightly different specialties, and we'd all work together on that complex injury. Most injuries will heal themselves within a few weeks, and if you find that the injury you have is not one of those, that's when you need to find out exactly what's going on. And then as far as the treatment's concerned, it'll depend on what the injury is. If it's we struggle a lot with tendon injuries. Tendons are interesting things. They don't like any dramatic changes in activity levels, and when they get damaged, you can go through an acute phase where it's inflamed, and then you can get this chronic phase where there's no longer inflammation, but it's still painful, it's still not functioning. They can be quite difficult to deal with, and for those there's a series of different types of injections we can use. The PRP is quite a popular injection now, and it's used for a lot of chronic injuries, and that's the platelet-rich plasma. And in that substance, which we take from your own blood, there's a lot of growth factors, and they can help kickstart your tissue recovery. And so we use that in a lot of tendon injuries. We can also use it in muscle injuries as well, so a lot of the recalcitrant stuff. There's also prolotherapy, which is another type of injection therapy, and that one is about trying to initiate the body's natural inflammatory response and recovery. So that's another type of injection. We also use steroid injections where there's a big inflammatory component, and we try to settle that one down. So there's a lot of injection therapies that we're using. We want to introduce here extracorporeal shockwave therapy, which is something specially designed for tendinopathies, so those chronic long-term tendon injuries. You find that you get an anatomical change in the tendon, the structure of the tendon changes, you can see it on ultrasound, and the shockwave therapy helps break that down and restore the natural anatomy of the tendon, and then helps with that particular problem. So that's especially good for big tendons like your Achilles. It can also be used for things like your epicondylitis, so your golfers and your tennis elbows, those sorts of things, and there aren't a lot of good other treatments for those, apart from injections, the shockwave therapy. I always, though, remind all athletes that I work with that when you're recovering from an injury, it's very similar to when you're training in the first instance. If you want to improve anything in sport, improve your speed as a runner, improve your size and your strength as a bodybuilder, you know it's going to take you months. You're starting with tissue, which is at a certain level, and you want to alter that, and it's going to respond to training. And when you're dealing with an injury, it's exactly the same thing. You're dealing there with tissue, in most cases, there's no quick fix, and what we need to do is we need to work with you over a series of months, and there's usually no one single remedy, but it'll be a combination of approaches, and this element of it might give you a 10 or 15% improvement, and that element will give you 20%, and that one will give you another 10%, and by combining it all together, we can get you back where you need to be.
What advice would you have for youngsters' parents when they're getting their kids involved in sports? Because, as we know, a youngster might say this hurts, but not sure where the actual injury might be, but then they say it doesn't hurt anymore because I want to play, kind of thing. Yeah. Advice you can give to a parent to make sure that their young one is healthy, kind of most of the time doing a sport, as opposed to as recurring an injury or making an injury quite worse by not getting it addressed.
The main injuries I see in sport with youngsters, with children and adolescents are when they're overtraining, usually, because there's certain sports where they do a lot of training, and whether that be gymnastics or swimming is they do many hours a week, and you often find they're the sorts of injuries that won't go away with the youngsters. Because their bodies are younger, because they're still growing, it means that they've got a better capacity to heal, because the same process involved in growing is what heals our damaged structures. And so for most injuries, they will recover quite well, and pain can be a good guide. If the pain's gone away and they're functioning again, then you know they're okay. But it's usually those which are overuse, overtraining, they're not getting a chance to recover properly. And for those, they need to come and see us, and there will definitely be a rest period involved in that. And then the possibly scaling down of the training. But the big thing is that when we're reintroducing it, there's a tendency to go back into full training too fast, and they'll get re-injured again. So we try to scale it down and give some sort of idea of the time frame, and also the progression of activities that they should be doing.
What about those elite athletes that are not just domestic training, but international training, preparing for international competition? That scaling back, can that damage, I guess, their profile, or will it give their careers a lot longer life? We need to be pragmatic when we're dealing with athletes, and if it's their livelihood, then we completely understand that. So we're not going to be unrealistic and say, look, you need to stop this or you need to stop that. And so often with them, it's about making quite complex decisions with them, along with them, about what's the best way to make sure that they're still progressing their careers, are still able to be active, but they need to address their problem as well. When's the right time frame for them to do that? There might be a natural lull in the season that you might want to try and get them through to that, so that we can then focus on rehabilitating them to get them ready for the next season. Okay. Well, I want to thank you for your time and welcome to Bermuda. Hopefully this interview actually gets you more people to come in and be open to seeing a doctor about recovery, because it's very important that athletes, whether they're amateur or elite, take care of their bodies, because you have a life after sport. 100% agreement with you there, Mr. Bozeman. Okay.